A lot of patients I see would prefer to have less invasive treatment than spine surgery. Very often a patient will have been offered a spine surgery treatment and come to me to see if there's other options besides spine surgery that can be done to treat their pain condition. It's important to preface this discussion by saying if a patient has some sort of critical injury to the spine, let's say they have very severe stenosis or narrowing of the spinal cord and are at risk of severe injury, or they have nerve compromise and a neurosurgeon has recommended surgery because they believe that a nerve is at risk that they can potentially save by doing surgery, then it's more important that they address the surgical solutions and talk to the surgeon about it and make sure that it's okay for them to try things less invasive than the surgery. But for many patients that are given surgical options that don't want to pursue surgery, there are ways of managing their pain short of surgery. Usually requires selective injections of the structures that are causing the pain. So very often patients have a combination of pain generators in their spine. So they may have degenerative changes where they have a herniated disc. The disc is irritating a nerve root, and they also have some joint pain in their back. So they have severe back pain as well as nerve pain into the leg because of multiple factors. So they have the disc, which hurts. They have the disc pushing on or irritating a nerve root, causing pain in the leg, and they have even worse back pain because they have joint involvement. This sometimes takes sort of a multifaceted approach to treat, because you want to treat each of these pain conditions and they each require a little bit different type of treatment. For the disc and nerve pain, we can often get relief with epidural steroid injections. We can get facet joint pain treated using selective injections or something called radiofrequency, which is a very accurate way of burning the nerves that go to the joints. And in some cases, we'll combine that with physical therapy, yoga, sort of traction techniques, getting patients on a very selective exercise program, nutritional supplementation. We use a variety of tools in order to get relief of the pain and get the patients in a position where they can best heal short of surgery. In some patients that don't want their spine operated on and are, for example, told that they need a multi-level fusion, if their spinal cord or nerves are not at risk, again, there are procedures that we can do simply to relieve pain, and one of those is a spinal cord stimulator. And we can use a spinal cord stimulator and relieve the pain of back and nerve pain. And in some patients, they don't want to have a 2 or 3 or 4 level fusion, and I can't really blame them. And in those patients, we'll sometimes recommend a spinal cord stimulator trial. And a trial is putting some electrical leads in the epidural space outside of the spinal cord, but affecting the spinal nerves, and using electrical stimulation to substitute that feeling for pain sensations. And if the patient gets very good relief, then we can put a stimulator in. It's like a little pacemaker that generates electrical signals, and they can have pain relief for a prolonged period of times, often for years, by using that without resorting to surgery. If they ever required surgery in the future, it's not a big deal. They can always have the surgery that changes their spine mechanically. But this is a surgery that doesn't do anything to the spine mechanically, it just provides relief of the pain. So the patients don't really lose anything, and they may gain several years, and that's important. Typically, the longer you can put off a fusion surgery, the better. Again, unless you really need that surgery because of nerve compromise, then you can avoid what's called adjacent segment disease. So adjacent segment disease takes place after having fusion surgery. Once levels are fused in the back, they don't move, and patients can have very good pain relief. However, it begins to stress the level above and below that fusion, and that starts as soon as they're fused, and it can progress rapidly or it can progress slowly, but over a period of years, they're probably going to have disease at an adjacent segment. So putting off surgery actually is advantageous because you delay the possibility of adjacent segment disease.